Growing up, Dr. Rania Awaad didn't have a high opinion of psychotherapy.
I really thought to myself, what good Muslim girl needs that garbage, to be very honest with you.
Rania was deeply committed to her faith. So much so that in college she decided to earn a degree in Islamic law and theology. It was her second passion, though, women's health, that led her to apply to medical school to become an obstetrician. But right before she began her studies, something happened that made her reconsider the attitude she'd had towards mental health treatment.
A person in our community was experiencing a first break psychosis, but none of the teachers or scholars or very educated people could explain what was happening. Everyone kept saying, we just need to pray for her, or maybe she's possessed. One of the community elders, who was a dentist, so imagine completely different domain, said, this is actually a medical emergency. This young woman needs to go into the ER. And everyone said, the ER, that's ridiculous. Nobody really even understood that this could be something that's medically treated. And she did go into the ER. We actually got her some help and she improved.
In that moment, Rania realized that while deep religious faith has many benefits, it can have drawbacks too. It can limit when, where, and how people seek help, especially when it comes to their mental health.
That evening, my husband said to me, look, there are a lot of people out there who can help deliver babies. Not many people are trained in the Islamic tradition, classically trained as a scholar, to be able to then help the mental health issues of our community. And that's what led me to jump ship from OB, essentially. And that's how I ended up here.
Where Rania ended up is a long way from the therapy skeptic she was as a devout young woman. Today, she's a professor of psychiatry at Stanford and one of the leading voices on Muslim mental health.
Islam as a religion absolutely promotes mental health and wellness.
On this episode, we'll hear about how she's working to bridge the gap between Islam and mental health treatment.
They said, we need historians of medicine to read into what you're trying to say because you're literally trying to rewrite the history of psychology. And I said, yep.
And we'll hear from Dr. David Rosmarin, a psychologist and director of the Spirituality and Mental Health program at McLean Hospital, and author of the new book, Thriving with Anxiety, about how integrating spiritual concerns into mental health treatments can improve people's outcomes, even when they don't identify strongly with any faith.
I think it's an innate spiritual need on the part of many. We need to treat the whole person.
I'm Dave DeSteno, and this is How God Works. When you break a bone, run a fever, or have a tumor, it's pretty clear it's a physical problem. It's something happening to you, not because of you. But if you're feeling anxious, depressed, or acting out of sorts, it may be harder to see it that way. Maybe it is because of you. Maybe it's a personal failing. Or in cases of more severe psychopathology, maybe it's something supernatural. Either way, it's a private thing. Something to talk about with people you trust, people you think might have some insight, who would understand you. But for many Muslims, that group doesn't include psychologists.
So every study we've done on this topic, where we ask, who would you go to if you or your loved one had a mental health condition? And friends and family always compete for number 1 and 2. And in the Muslim communities, the imam is usually number 3 right after that. And the mental health professionals are down at the very bottom of the list. Even family doctors come before the mental health professionals.
Across all religions, about a quarter of people look to clergy first for help with mental health, thanks to a combination of unfamiliarity with other options and deep skepticism toward the use and value of therapy. It was something even Rania struggled with early in her studies.
When I got to Stanford to train in psychiatry, I was so hesitant. I might even use the word paranoid, really, of this field, just not really sure what my place was in this field. And so that led to a lot of digging up of history.
As Rania started digging into that history, what she found surprised her.
There is this incredible heritage. Islam as a religion absolutely promotes mental health and wellness. What's really interesting about Muslim population, so there's Islam, the religion, then there's the Muslim population, that today seems to be really cut off from a lot of what that heritage once was. Many felt was very Western. It didn't have origins in Islam, and therefore it wasn't going to be any use to us. That's kind of the rhetoric that I would hear often. The origins of modern psychology is definitely very Eurocentric, 100%. But the reality is, if you go further back into the history of psychology itself, it has much, much further roots, but you're not going to find that in your history of psychology courses.
When you open any Psych 101 text, you'll see that psychology started round about 1900 with one Dr. William James. Well, there's also that Freud guy, but he's got a lot of issues. Anyway, not to diss my colleagues here, but the study of the mind and how to help people who are suffering from its maladies goes much further back than James. And if you go back far enough, it's not the psychologists offering the wisdom. It was religious thinkers. Take Buddhism, for instance. Centuries ago, the Buddhists had already developed an elaborate science of the mind, one that, in many ways, is providing insight to clinicians today. As it turns out, the same is true for Islam.
I was pulling out manuscripts from 7th, 8th, 9th, 10th century, like old manuscripts. And I started with the Muslim physicians of that time. But then I realized that this field, which we would today call roughly Islamic psychology, they called it in their terms in Arabic, ilmun nafs, which translates into the knowledge of the self. It was a very interdisciplinary field. So yes, physicians contributed, but so did theologians, so did philosophers. And it actually turned out that we were looking at all types of different manuscripts to really understand what was this field. I published these early papers on a 9th century scholar by the name of Abu Zayd al-Balkhi. He basically figured out what OCD was point by point to what you find in the DSM-5 today. Like his diagnosis and his treatment, which also is a form of a cognitive behavioral therapy known as exposure therapy, which is exactly what we use today to treat OCD.
How many years ago are we talking?
So 9th century. So basically a millennium before the current person in the books of psychology history that is credited with finding OCD, of an entire millennium of a difference.
Wow. One point I want to follow up on that you were mentioning is Islamic psychology, to use that term, was kind of interdisciplinary. There were the physicians, there were the philosophers and other people. And what that suggests to me is that in treating or helping people who are experiencing psychiatric disorders, that there's room for something that may be beyond just popping the pill. And I'm not trying to diss, psychopharmacology. It's hugely beneficial. It helps in lots of ways. But I'm wondering, is what they were doing then something that we would today term spiritually integrated therapy?
I would definitely say spiritually integrated. Let's take the example of Balkhi again from the 9th century and OCD. So when you look at his treatment regimen, it breaks down into 3 parts. The first actually is what we would call today psychopharmacology, and giving actually a recipe or concoction of what you would take orally to be able to treat this illness, so medications. Second on the list, he would say, this is where you need the exposure therapy, so talk therapy. He was definitely, I would say, one of the first to really identify the importance and benefit of talk therapy. This is, again, centuries before you find talk therapy really being used in modern psychology. And thirdly, this is so interesting to me, he says, and don't forget that when God sends an illness, he also sends its treatment, which is actually a prophetic narration. And he quotes verses of the Quran and also sayings of the Prophet Muhammad, peace be upon him, and encourages the patient to not lose hope. And the backstory is one of the companions of the Prophet Muhammad, peace be upon him, came to him and asked him, if we were to get ill, should we seek out treatment? And the underlying question there essentially is it enough to just sort of pray? Like you're going to the prophet of God and you're asking, look, if I'm sick, what do I do about this? And the Prophet Muhammad doesn't launch into a discussion on prayers and have reliance in God. Instead, what he says is, seek out treatments, O servants of God. And he repeats, seek out treatments, O servants of God. For God does not send down an illness, except that he also sends with it its cure. So that's the full narration. And that becomes really important and quoted heavily in this kind of almost an impetus for the scholars of the time, the physicians of the time, to have that spiritual integration, to say, well, if we see an illness in front of us, God has promised that he's also going to send its cure, but it doesn't necessarily just fall out of the sky. So all three aspects, so medication, talk therapy, and kind of having a religious outlook, spiritual outlook that really helps the person get better. And that's what you find throughout all of these physicians and writers that I was looking at. They have a very interdisciplinary, integrated way of healing.
As Rania was starting to make these connections, she faced a lot of pushback. It wasn't only Muslims who didn't see the value in integrating religion and medicine. Many doctors didn't either.
My very first grant that I wrote to study religion and mental health was an internal grant within our department. And I received back my grant application, and the whole thing was marked up in red ink. And at the top of the corner, it said, "This research is a disgrace to the field of psychiatry and has no place in this department." This is not that long ago. And I just thought, oh my goodness, I don't think I can carry out what I want to do here. And when we sent the first of these papers to the journals to publish this, they immediately got sent back. And they were like, "This is unorthodox, what you're trying to claim here." And I thought it was such a funny terminology, unorthodox. And they said, "We need historians of medicine to read into what you're trying to say, because you're literally trying to rewrite the history of psychology." And I said, "Yep."
But it wasn't only the rewriting of history itself that was having an impact here. Rania's work was also reestablishing connections to older interpretations of Islam, ones that had been lost over time.
And this is where the sciences come in to really try to figure that out. So the Islamic heritage in its heyday, you see this incredible advances in the sciences, in the humanities, and in medicine in particular. And a lot of that, the impetus comes from this prophetic saying and that overall cultural shift of we actually need to treat these illnesses. And mental illnesses were no exception to that.
It makes me think about what in psychology we often call positive or negative religious coping. You can be angry or feel ashamed, that is, why is God doing this to me? Or I must have done something wrong because God is letting this happen to me, versus relying on God, if you're a believer, for strength and solace. That is, God cares about me. There is a way for me to overcome this, or he wouldn't let this happen to me. What do we know about those different types of interpretations and how it relates to people's outcomes?
I find myself doing a lot of cognitive reframing with my patients who are of spiritual faith backgrounds. And they're coming with exactly this kind of sentiment of maybe God is testing me because I did something wrong. So I can agree with the first part of the statement of God says that he will test us. I mean, this is part of the Quran, like you will be tried and tested. We know that definitely. And everybody will have different forms of testing. Could this mental illness or could this illness, whatever it may be one of those tests? Possibly. Does it have to be that you connect the dots to something bad that you did or that you didn't do enough of something else and this is why? That's where we kind of draw our hands up and say, only God knows, right? Allahu Alam, only God knows. Let me tell you about another prophetic saying that kind of helps frame this a little bit better. That says, whoever God wishes good for, he tests them with trials and tribulations to better them. It's almost like this way of honing a person and helping and shape their character with trials and tests. And so that usually helps a lot of people. They realize there's a saying of the most tested of all people are the prophets of God. And then the people who are the most beloved to God. And so that's usually a very helpful way of realizing, oh, wow, I've been getting a lot of these tests. Maybe I'm actually beloved to God, not the opposite, right? And that could be very useful.
When it came to getting devout Muslims on board, this way of integrating faith made a lot of sense to Rania and seemed more promising than starting with the science.
You can either do this from a top-down approach or a bottom-up approach. The top-down is simply, here's what modern psychology is, and I'm going to Islamicize or Arabize the terminology that's there. Whereas the bottom-up approach is, actually, I'm going to start with the faith itself and build upon that foundation a psychology. And that would be my bias of kind of building a psychology on up and then integrating it with modern practice, bridging it to all the good that modern psychology and psychiatry has to offer, but really from a core tradition. And this is where that spiritually integrated therapy becomes really important for people of faith, Muslims and other folks of faith, that we don't feel like we have to, quote, check God at the door before we go into therapy.
This kind of spiritually integrated care is showing clear results in reaching and convincing a once reluctant community.
And it's been incredible, actually, to see within this Muslim communities, they fully accept there are biological, genetic explanations to mental health. They don't believe it to just be spiritual. But then when you talk about access to care, now the story shifts. And we see from the studies we're doing in the clinic directly that if you're able to integrate the faith in, or even have people of same faith background doing even standard therapy, it actually significantly improves their access to care.
And sometimes that care isn't just spiritual integration, it's true collaboration.
You'll have Muslim families who come in and they're like, but I think this is supernatural possession, and I really need the imam to do Quranic reading, or ruqya is the word, for this patient. And so here too becomes this really interesting intersection where we say, well, can we do both potentially? Right? And kind of building rapport with their faith leader and trying to convince them to stay with the psychiatric treatment because there could be benefit in both things. And those who are dual trained, like myself, having the language to be able to train the imams and gain their confidence and trust has been incredibly important in this process.
And that growing comfort with spirituality is working the other way too. It's also the mental health professionals themselves who are realizing that religion can play a role in treatment.
At the APA, the American Psychological Association conference, this was the first year in the APA's 130-some-year history that they had a topic on mental health and religion on their main stage. This was the first time in their entire history. And I was very honored to be one of the speakers. And it just kind of blew my mind that it's taken us this long to understand the importance of bringing in spirituality, faith, religion into the mental health treatment process. So it's been a journey.
David Rosmarin was a bright young trainee at Harvard's McLean Hospital when he was first blindsided by a patient's question.
Excuse me, can I talk to you about God? Can you pray for me?
Those aren't typical questions for a psychologist. So where did they come from?
I am an Orthodox Jewish individual, and I proudly wear my yarmulke to work.
As it turned out, many patients saw that as an invitation.
Now, within 6 months, no less than 10 patients have come over to me with the same question. Can I talk to you about God? Why is God doing this? Why am I depressed? Can you pray for me?
It was something he wasn't trained to discuss. After all, he was there as a psychologist, not a rabbi.
Frankly, it was just really awkward. Like, here I am, a trainee. I don't want to have these conversations. Yes, it's part of my own identity, but that's not why I was at the hospital.
So he did what any young doctor might. He asked his boss.
I went to my advisor and I'm like, what do you want me to do the next time a patient comes to me and says they want to talk about God? They want to talk about their mental health in spiritual terms, not in psychiatric terms. And he leaned across the desk and I thought I was going to get fired. And instead he said, Rosmarin, you got to do something about this. Clearly, a subset of our patients want spiritually integrated care. You have to did I just say divine it? A funny slip. You have to devise it and create something that is going to benefit our patients. And we also have to start doing research, like how many of our patients want this? How many of them have spiritual beliefs? Are those clinically relevant?
David got some funding to research those questions. And so for the next several years, he asked his patients questions like, do you believe in God? Do you regularly attend a church, a synagogue, or a temple? Do you think your spiritual beliefs are relevant to your treatment here? The results were nothing short of astounding. Even in the greater Boston area, one of the most secular parts of the country, nearly 60% of patients said they wanted spiritually integrated care, a number that climbed even higher after COVID. But what's even more surprising? 40% of those patients had no religious identity. They weren't regulars at worship services. And that led David to a revelation.
A lot of people for whom you think spirituality is not relevant, it is highly relevant, and it is associated with mental health in positive and negative ways, sometimes to the tune of 40 or even 50% of things like depression, suicidality, anxiety. It impacts aftercare. It impacts the reasons people seek treatment. So once that data became available, it became apparent, as a leader in psychiatric care, we need to treat the whole person. And I was charged to create a hospital-wide spirituality and mental health program.
It sounds like the folks at McLean were very supportive and open to this. Do you get pushback from any colleagues about trying to integrate spirituality in what is usually kind of a very secular healing tradition?
Yeah. Of all the healing traditions, psychiatry is the top one in terms of secularity compared to other physicians. So psychiatrists are less likely, even than surgeons, and then all other forms of medical doctors to be involved in spirituality, to have positive views of spirituality, not to pathologize spirituality and religion. So that goes back to Freud, who just lambasted spirituality and God and called it a neurosis. And there's still vestiges of that here over 100 years later.
When the patients first come and say to you, I want to talk about God and this problem I'm having, whether it's anxiety or depression or whatever it might be, what's usually on their mind? Like, what aspect of God do they want to talk about?
It's a great question. It basically boils down to 4 buckets of patients who want to talk about God or spirituality. The first group of patients, spirituality is a benefit to them. It's a help to them. It gives them hope. It gives them meaning. It gives them structure. It gives them purpose. It gives them community. It gives them all the things that your research has shown us and many others. And they are finding that the rest of their psychiatric treatment is not addressing issues of higher meaning. It's not addressing issues of purpose. It's addressing issues of symptoms. It's addressing issues of behavioral factors. It's addressing pharmacology, but it's not addressing the why of life. And for many people, they want to have that as a part of their care. So that's group 1. Group 2 are people who are struggling with their faith. Why on earth am I depressed? Why is this happening to me? I have a great life, but I can't get out of this funk. I'm so anxious. Group 3 is the smallest group of people who actually gets the most ink in psychiatric journals, which is the folks who have spiritual and religious symptoms, religious OCD, scrupulosity, religious delusions. We see it in mania, hypomania, increased religious activity, basically what I call religious symptomatology. And to be clear, religion does not cause those symptoms. Rather, when people who have faith experience OCD, experience mania, experience psychosis or others, those symptoms take on a cultural flavor like they would for anybody. It's just that it happens. If you live in Washington, D.C. and you have psychosis, you're going to probably be thinking about delusions about being a political figure. It just goes with the territory. If you live in Egypt, you live in Cairo, and you have psychosis, you're going to have religious symptoms. That 4th group is actually the most fascinating. These are people who are not religious, not spiritual. Spirituality they don't think is relevant, but they're like, that's interesting. I wonder whether there's something here, and I'd like to explore this as a piece of the puzzle. Those are the 4 groups. They're not mutually exclusive, but those are basically what they want to talk about.
Yeah, it's interesting. For thousands of years before we had modern medical science, I imagine if you had psychiatric issues, depression, anxiety, whatever it might be, one of the people you would go to would be your rabbi or your priest or your minister for advice.
They still do, in droves. In fact, clergy are twice as likely to get referrals, so to speak, self-referrals, for mental health issues today as mental health professionals, much to the chagrin of myself and the profession, frankly, because it creates a lot of burden on clergy.
It can be burdensome, but also dangerous, especially in the case of serious mental illnesses.
Like psychosis, like schizophrenia, like severe depression involving suicidality. People are far more likely to go to their clergy first before they come to a mental health professional.
While David helps people with many afflictions, treating anxiety is one of his specialties. It's also a disorder that he thinks can respond especially well to spiritually integrated treatment. In fact, he argues that, stay with me here, anxiety can actually be thought of as a blessing rather than a curse. I know. I had some questions too. I'm an anxious person, and it seems like a curse to me. But David suggests we should think of it differently.
Anxiety is part of the human condition. When things are uncertain, when you don't know what's going to happen next, when things are out of control, which, by the way, is going to happen to all of us because we're human, we're only so powerful, we're only so big, we're going to feel anxious. Our fear system, the fear circuit, starting with adrenaline, is going to get activated. And That's not a bad thing. What that means is that we have neural health, we have emotional health, we have a range of emotions. There's only one type of person I know who doesn't get anxious.
Who's that?
Someone who's dead.
That's what I was going to say. Fair enough.
That's it. There are some people who have a lot less anxiety. People who are overusing substances in the moment don't have a lot of anxiety. And then also psychopaths, people who have psychopathy,
Right.
sociopaths. Bottom line is you want to have some degree of anxiety. Anxiety is not a disease. If it is part of the human condition, I believe it's here for a reason.
No, it's true. I mean, every evolutionary biologist would tell you the reason we have anxiety is because it can protect us from threats.
Yeah. But there's other aspects, though, that I think taking a spiritual lens to the topic of anxiety has opened up to me. Just being there when people can talk about their anxiety, can talk about their sadness, can talk about their pain. Instead of trying to fix it, which we do in psychotherapy or which we do in psychiatry today, just being present with them. How do we live with the uncertainty? Like, if you really step back, how much do you control, Dave, of your life?
I'm learning less and less.
The more you think about it, the less you, right? How many people have been on this show that chose when, where, and whether to be born?
That's true. None of us.
I didn't pick my genes. I didn't choose to be 5'7", and I wouldn't have.
That's right. I'm 5'6". You're ahead of me.
But I didn't choose so many things. I didn't choose my socioeconomic status. I didn't choose the color of my skin. I didn't choose the family I was born into. I didn't choose to be born. How many of those factors are in my control? So few. Isn't that anxiety provoking? Yes, and that's such a good thing. Our anxiety can bring us into a place of greater acceptance and greater humility and greater resilience when things don't go our way. And a greater sense of equanimity, where we can parlay our anxiety by facing those realities into a sense of spirituality that otherwise we would not have.
Equanimity is something we've heard a lot about on this podcast, especially in the context of Buddhism. But many traditions aim to help us manage our emotions by giving us ways to sit with them. Just sitting with your thoughts might sound like a bad idea for an anxious mind, but that's where spiritual practices can help. For David, it's the Sabbath.
I'm not going to work during dinner. I'm going to take a vacation, and I'm actually going to put an autoresponder on and be on a holiday, a sabbatical, so to speak. And the concept in the general sense, even if without its religious specificities, I think has tremendous implications for our mental health. And anxiety teaches us to do that because I get too ramped up if I don't take a break. And that's my body's way of saying, like, hey, David, accept the fact that you're not in control, take a break, go to bed, turn off your phone, time to chill.
But how about the issue of finding meaning and purpose? And we know from the flourishing literature that people who have and find meaning and purpose in life, there is some protective factor for their well-being. I think it's fair to say that spirituality supplies that for some people, but in a society that is becoming ever more secular, do you think that is contributing to that problem for a lot of people?
Yes, I definitely do. But I think the effect is a little bit different. When people don't have a sense of purpose, the default is I'm only going to think about me and my happiness right now. That default is what's creating the anxiety epidemic today. Because the minute we feel anxious, I'm a failure. Something's wrong with me. I've done something incorrect. I must be messing things up. Everybody else seems to be happy. If I'm focused on my mission and my purpose, I'm going to take the vicissitudes along the way. If I don't have a sense of why, I'm going to focus on me. And when I focus on me, anxiety is just going to happen.
Integrating spirituality into treatments for anxiety, depression, and related disorders is relatively new. So we don't yet have enough data to know how well it works. But there is one place where the benefits for many people are pretty clear.
12-step programs, including Alcoholics Anonymous, which are fully spiritually based. Most of them operate in the basement of churches.
There is a belief in a higher power that is a central part of that.
It is one of the central tenets in AA, in all the anonymouses, so to speak.
Belief in a higher power does help many people. But spirituality provides more than that. It can offer a sense of community, of empathy, of forgiveness. Join us in 2 weeks for part 2 of our series on religion and mental health, as we take a closer look at the promise and perils spirituality holds for treating addiction.
I think that what addiction is basically love gone awry. And it goes astray when it becomes attached to a substance or to a harmful person rather than to somebody that is making our life better.
And why it is that so many 12-step programs urge people to believe that a higher power can help control their outcomes.
Across the spectrum of health outcomes, we tend to find that people with higher divine control are better off in terms of health and well-being.
How God Works is hosted and written by me, Dave DeSteno. Our senior producer is Josie Holtzman. Our producer is Sophie Eisenberg. Annika DeVries is our intern. Executive producer is Genevieve Sponsler. Merritt Jacob is our mix engineer and composed our theme, which was arranged by Chloe DeSteno. The executive producer of PRX Productions is Jocelyn Gonzalez. This podcast was also made possible with support from the John Templeton Foundation. If you want to learn more, you can find our website at howgodworks, all one word, .org, or follow me on X or Blue Sky at David DeSteno.